The South African healthcare system, a crisis in free fall. The South African healthcare system is currently facing a profound crisis, one that is taking a severe toll on both patients and healthcare workers. The system is overwhelmed with issues ranging from underfunded hospitals to an overburdened and exhausted medical staff. There is an alarming shortage of resources, a lack of empathy from those in power, and a clear absence of accountability. These problems have only worsened in recent years, leaving millions of South Africans to suffer in a healthcare system that seems to be in free fall. A system on the brink. Public hospitals in South Africa are facing an overwhelming influx of patients, often to the point of collapse. Underfunded and understaffed, these hospitals struggle to provide even the most basic care. Patients are frequently turned away or forced to wait for hours, sometimes days, before being seen. The situation has grown increasingly dire as healthcare workers, stretched thin by long hours and a lack of support, are unable to meet the needs of the population. In these overcrowded, underfunded facilities, patients often face unclean conditions, inadequate equipment, and a lack of basic supplies. What was once a well-meaning system designed to provide healthcare to the most vulnerable has devolved into a broken, ineffective bureaucracy more concerned with managing red tape than addressing the real needs of the people it was meant to serve. A lack of empathy and accountability. One of the most disheartening aspects of South Africa's healthcare crisis is the glaring lack of empathy from those in positions of power. Far too often, government officials and healthcare administrators are more concerned with maintaining a facade of order than actually improving the lives of those who rely on public healthcare services. It is a system that prioritizes bureaucracy over patient care, with decisions made at the top that seem disconnected from the realities on the ground. For those who work in the healthcare system, this detachment from the needs of the people is even more evident. Medical staff, from doctors to nurses to support personnel, are overworked and underappreciated. Many of them are stuck in a cycle of burnout, yet they continue to soldier on despite the mounting pressures. However, the real problem lies in the decision-making process at the highest levels of government and healthcare administration, where those who have the power to make changes are often more concerned with politics and budgets than improving the lives of the most vulnerable. Conscripted doctors, exploited and overworked. A particularly troubling issue within the South African healthcare system is the exploitation of conscripted doctors. These are medical students who have agreed to work off the university tuition by serving in public hospitals. While the intent behind this system might have been to address staffing shortages, the reality is far different. Conscripted doctors often find themselves working up to 24 hours or more at a time, with little rest or support. The workload is relentless, and they are expected to manage heavy caseloads with limited experience and even less guidance. This grueling schedule, combined with an overwhelming lack of resources and support, leads to burnout, fatigue, and high levels of stress among these young professionals. Instead of gaining meaningful medical experience, many conscripted doctors are simply being exploited as cheap labor. Their role is often that of a workhorse, with little regard for their well-being or their need for proper supervision and mentorship. In many cases, these young doctors are left to make critical decisions with little to no oversight, putting both themselves and their patients at risk. The psychological toll of exploitation. The exploitation of conscripted doctors has far-reaching psychological consequences. Medical students who enter the program with idealistic views of helping others often leave disillusioned and burned out. The long hours, lack of support, and overwhelming pressure create a toxic environment where passion for medicine and patient care is slowly worn down. The emotional and psychological toll of working in such conditions is immense. Conscripted doctors often report feelings of helplessness, frustration, and exhaustion. They are expected to provide the highest standard of care, yet they are given few resources and little time to do so. The constant pressure can lead to feelings of inadequacy and self-doubt, especially when mistakes are made due to fatigue or lack of experience. A broken system of accountability. The South African healthcare system also suffers from a chronic lack of accountability. Hospital administrators and government officials often pass the blame for failures down the chain of command, while doing little to address the root causes of the crisis. In a system where funding is scarce and resources are limited, it is easy to understand why healthcare workers are frustrated. However, the real issue lies in the systemic corruption and mismanagement that plagues the industry. In many cases, hospital staff are forced to work with outdated equipment, insufficient supplies, and a lack of infrastructure. This results in a system where patients often go without treatment or care, and healthcare workers are left to carry the burden of a failing system. While the government may claim to be addressing these issues, the reality is that solutions are often delayed, and the lack of political will to make meaningful change only exacerbates the problem. The consequences for patient care. The consequences of these systemic failures are dire. As doctors and nurses are overworked and exhausted, the quality of patient care suffers. Long waiting times, incorrect diagnoses, and delayed treatments are just a few of the issues that plague the healthcare system. With hospitals struggling to keep up with demand, patients often face unnecessary suffering and even death. When medical professionals are stretched too thin, their ability to provide quality care is compromised. For example, conscripted doctors, with little supervision and an overwhelming caseload, are left to make difficult decisions without the experience or resources necessary to do so. This often leads to mistakes, which, in turn, exacerbate the suffering of patients. The lack of adequate resources, poor working conditions, and a broken system of accountability create a vicious cycle that ultimately harms the most vulnerable members of society. It is the patients who pay the price for a system that is more focused on maintaining power and managing budgets than it is on improving healthcare. The way forward, reform is urgent. The need for urgent reform in South Africa's healthcare system cannot be overstated. The exploitation of conscripted doctors must end, and the government must prioritize the well-being of healthcare professionals. Proper compensation, adequate rest, and better working conditions are essential to ensure that these young professionals can provide quality care to the patients who depend on them. Additionally, the system must be held accountable. Those who manage public health care must take responsibility for the failures of the system and make the necessary changes to address the issues that are so deeply ingrained. This means greater investment in healthcare infrastructure, improved management of resources, and more support for healthcare workers at all levels. Finally, patient care must be placed at the forefront of any reform efforts. The healthcare system must be restructured in such a way that patients receive the care they need in a timely and efficient manner. This requires not just financial investment, but also a shift in priorities to ensure that the healthcare system is serving the needs of the people, not the interests of bureaucrats and politicians. The South African healthcare system is in crisis, but it is not beyond saving. However, this will require bold leadership, systemic reforms, and a commitment to placing the needs of patients and healthcare workers above all else. Without these changes, millions of South Africans will continue to suffer from a system that has failed them for far too long. The tragic reality: patients left to die. One of the most heartbreaking consequences of the healthcare crisis in South Africa is the number of patients who are left to die due to the overwhelming dysfunction of the system. As public hospitals struggle to manage an ever-growing patient load with limited resources, countless individuals are denied the care they desperately need. The tragic reality is that, in many cases, patients are forced to wait for hours, days, or even weeks before receiving any form of treatment, by which time, their condition has often deteriorated beyond repair. The impact of overcrowding and underfunding. Overcrowded hospitals and clinics are a common sight in South Africa's public health sector. The most vulnerable members of society, those who cannot afford private healthcare, often find themselves in desperate situations, with little recourse for timely treatment. With limited beds, lack of medical staff, and an insufficient supply of medicine, hospitals are unable to keep up with the demands placed on them. This results in patients being turned away or left waiting for long periods in conditions that are unsafe and unsanitary. Many die while waiting for care. In some cases, patients with life-threatening conditions such as heart attacks, strokes, or severe trauma may arrive at hospitals only to be left unattended for hours or even days. For those suffering from chronic illnesses, delays in treatment can exacerbate their conditions, leading to premature death. What is even more devastating is the fact that these deaths are often entirely preventable, yet patients receive the necessary medical care in time. The failure of the system: a lack of prioritization. In a healthcare system that prioritizes bureaucracy and management over patient care, the result is a tragic disregard for human life. Patients are often treated as numbers on a waiting list rather than individuals in need of urgent medical attention. The failure to triage properly, combined with insufficient staffing and a lack of adequate resources, means that many patients fall through the cracks, waiting for care that may never come. What compounds the issue is the government's failure to address these systemic problems. Rather than allocate funding and resources to where they are most needed, such as ensuring hospitals are adequately staffed, equipped, and capable of handling the volume of patients, the focus remains on issues like red tape and political agendas. In the meantime, patients are left to suffer, with little to no recourse for justice. The human cost, lives lost to inaction. Perhaps the most painful aspect of the South African healthcare crisis is the sheer number of lives lost due to a failure to act. Every day, patients die due to neglect, inadequate care, or a lack of access to medical services. These deaths are not merely statistics, they represent fathers, mothers, children, and grandparents, individuals who could have lived if only they had received the care they deserved. The most tragic cases are often those of people who could have been saved with timely medical intervention. In hospitals, patients are forced to wait while doctors and nurses are overworked and stretched to their limits. In some cases, patients die while lying in beds, left to fend for themselves in a system that has failed them. The role of conscripted doctors, a cycle of exploitation. In this context, the exploitation of conscripted doctors takes on an even darker dimension. These young professionals, many of whom are working to pay off their university tuition, are often forced to work long hours, sometimes exceeding 24 hours at a stretch, while being expected to provide quality care under impossible conditions. With little time for rest and few resources to work with, they are unable to properly attend to all the patients who require their attention. As conscripted doctors struggle to manage heavy caseloads, many patients who need immediate medical care are left unattended, further increasing the risk of preventable deaths. The system relies on the exploitation of young doctors, many of whom are still learning, without providing them the mentorship or support they need to perform at their best. In this vicious cycle, both the doctors and the patients suffer, but ultimately, it is the patients who bear the greatest burden. The emotional toll on healthcare workers. The emotional toll on healthcare workers who witness patients being left to die due to systemic failures is immense. Doctors, nurses, and support staff are forced to deal with the psychological trauma of knowing that many of the deaths they witness could have been prevented with proper care and resources. This creates an atmosphere of frustration, anger, and helplessness that permeates hospitals and clinics across the country. For many healthcare workers, the inability to save lives because of systemic issues is deeply disheartening. It is not uncommon for doctors and nurses to feel a sense of guilt and frustration when they are unable to provide the care they know their patients need. This leads to a culture of burnout, where healthcare workers become emotionally detached in order to protect themselves from the constant trauma they face. A call for urgent action. The fact that patients are being left to die in South Africa's healthcare system is a national tragedy that demands immediate attention. No one should have to die because they cannot access proper medical care, and no healthcare worker should be forced to bear the brunt of such systemic failures. For real change to occur, the government must act quickly to address the deep-rooted issues within the healthcare system. This includes increasing funding for public hospitals, improving working conditions for healthcare professionals, and ensuring that doctors and nurses are properly supported and trained. Most importantly, the government must place the lives of South African citizens above politics and bureaucracy, ensuring that patients receive the care they need, when they need it. Patients who are left to die due to neglect and inaction are not just victims of a broken healthcare system, they are victims of a government and a society that has failed them. It is time to demand accountability and reform so that no one else has to suffer or die in such an unjust and avoidable manner.